Survivors of gender-based violence should be given proper support to come out of the trauma they have passed through. Those were the words of the Vice President Dolapo Osinbajo at the 37th Annual General Meeting and Scientific Conference of Association of Public Health Physicians of Nigeria. She said Nigerians should rally around and ensure that survivors have a network of support that will be a source of succor to them. She advised development organizations to provide useful life skills that will enable survivors to cater for their needs.
I'm glad for this innovative Orange the World campaign because it means without speaking a word, just by the color orange that you have upon you, you're reminding people of the cause. And the cause is to curb and end gender-based violence worldwide. My touch of orange today is a corsage. The corsage is just a flower or a bouquet of flowers that we put on our clothing. And I made it this morning. I crochet. I made this corsage this morning. I wanted something that I could move from one outfit to another. Each time I wanted to remind people about Orange the World. I don't think I have that many clothes that have orange in them. Handcrafts, like crochet, are also useful therapy. And this is one of the things we use as we help the survivors of gender-based violence. Because as you sit and stitch, as we call it, as you rummage through yarn, you can tell when all the colors she wants are dark colors and not bright colors. You can tell when she's forgotten for a season, forgotten for an hour, while she paints, or while she writes poetry, or while she stitches and does her embroidery or her crochet. This is one of the things, the holistic ways that we assist and give therapy to those that are survivors of gender-based violence.
Because why we're doing this is I think Professor Fatusin has mentioned, one of the weak links also is lack of capacity. We recognize the limited capacity, which is also has to do with the overall limited human resources for health within our health facilities. So what is most important is what he has said, is the goal is to work towards integration and strengthening the systems and capacities that exist within our existing health system at all levels of care, from the tertiary, secondary, and the primary levels of care. But most importantly, at the primary level of care, where a majority of Nigerians are expected to access services. We are also leaving the private sectors not behind. We are also strengthening and collaborating to effectively see how we harness resources and capacities within the private sector domain.
She says healthcare professionals play a critical role in providing formidable support systems to survivors of gender-based violence, while adding that they should not relent in the good work they are doing. Ulla country rep, UNFPA, who represented Kallon, UN resident coordinator in Nigeria, says there is need for more action so that women's voices will not be silenced.
Both pre-service and in-service to ensure we are able to respond, not only clinical care, but also prevention. C, community-based actions and clinical care. D, development of policies and programs. And E, not only development, but also evaluating those policies so we can know what works and what does not work. On this note, ladies and gentlemen, I want to say to us, gender-based violence ought all, either directly or indirectly, and it benefits no one. It's time to end gender violence in Nigeria.
He added that there is need to address the root cause of gender-based violence.